in a severe pandemic, the medical costs for insurers could be near $100 billion.
So what happens if I get the coronavirus?
You go to the hospital, right? The thing is, according to the Kaiser Family Foundation, treatment for those with major respiratory complications tied to COVID-19 are looking at hospital bills as high as $20,000. And even with little or no complications, you're still looking at around $10,000. Who can afford that?
Cigna was the first insurer to move to say it was going to cover all of the costs on COVID testing.
So, am I covered for coronavirus or not? Let's start with private health insurance. For those who are lucky enough to have comprehensive health insurance, they're now required by law to cover the full cost of coronavirus testing, as well as any visits to the emergency room, doctor's office, or urgent care center that may have led to the testing. The CARES Act also provides free antibody testing for COVID-19 patients. So what if I test positive? The good news? Many insurers like Cigna, Humana, and most recently Aetna are waiving copays for COVID-related medical treatment. So that means you're not paying anything out of pocket. This includes the costs for hospitalization and ambulance transfers for their insured members. Keep in mind that in most cases, this only applies to in-network care. So if you're not sure, check your insurer's website or just give them a call. Some people have been billed for visits that didn't result in a COVID-19 test, or their testing was done out of network. If your deductible isn't waived, the average cost out of pocket on an employer plan is around $1,655, and it's even higher for those who are on non-group policies. For those with Medicare, your coronavirus tests are also covered under the CARES Act. Depending on your state, there may be additional testing aid and relief, so make sure to visit your state government website to double-check your coverage. According to the Kaiser Family Foundation, almost 60 million Americans were registered Medicare beneficiaries in 2018. And depending on which Medicare you qualify for or carry, your deductibles will vary. For those who are on basic Medicare, the deductible for a hospital stay up to 60 days is $1,408. If medical services like a doctor's visit are involved, then you're covered under Medicare Part B, which carries a $198 deductible, and typically 20% of the Medicare-approved cost of treatment. Medicare Part D covers prescription drugs and also has no cap on out-of-pocket spending. And depending on your plan, the deductibles for prescription drugs can cost up to $435. Note that Medicare plans almost always use a network of providers to lower costs. However, the government now requires Medicare Advantage plans to cover out-of-network providers as long as they accept Medicare payments. So what about the uninsured? Well, with the passing of the CARES Act, $100 billion has been set aside to reimburse providers for coronavirus-related treatments and costs. Up to 2 million uninsured people could require COVID-related hospitalization, and providing care for those people should only cost up to $40 billion, excluding any treatment costs outside of the hospital. The details of how the funding will be distributed is still unclear, but the basic idea is that federal funds will be set aside to cover the uninsured. So what are my options? Truth is, only your healthcare provider can answer that. The American healthcare system is comprised of hundreds of different health insurance companies, with each one providing different levels of care. At the moment, there's currently no federal law requiring them to waive copays on any coronavirus-related treatments. But also, many of them have taken it upon themselves to waive those payments. So it's in your best interest to be as prepared as possible and look into the details of your specific coverage. If you recently lost your insurance due to layoffs, you might be eligible for other options like COBRA or a subsidized insurance plan on the Affordable Care Act market. Finally, make sure to check to see if your state is offering any emergency COVID-19 coverage, because things are changing every day, and you never know what state or federal laws and programs might become available in the future.